Hi everyone, in today's video we are going to learn about the internal surfaces of skull. So within this heading internal surfaces of skull there are presence of two internal surfaces. One is the upper surface, that is the internal surface of cranial vault, and second in the base of the skull, that is the internal surface of the cranial base. So in this video, we are going to learn about the internal surface of cranial vault. So this is the internal surface of cranial vault. This is the inner table of cranial vault, which is somewhat very thin and fragile. In the internal surface of cranial vault, there are presence of many impressions of various structures that could be the meningeal vessels, which provide the meninges and the internal surface of skull bones. Then there could be presence of the grooves, which lodges the venous sinuses. There are presence of various pits or granular foveolae, which are present on the internal surface of cranial vault. So also there might be presence of impressions of cerebral gyri. So if we start from the anterior portion, this in the midline, in the most anterior portion, there is presence of this frontal crest. So this is the frontal crest and this is the frontal bone. Then after that, there is presence of this suture which is present between frontal and the two parietal bones, which is called as coronal sutures, as we have already studied about it. So this is the coronal suture. Then behind the frontal crest, from anterior to posterior part of this cranial vault, in the midline, there is presence of a sulcus which is called as sagittal sulcus. So this is the sagittal sulcus. Sagittal sulcus is a groove-like structure which is responsible for lodging the superior sagittal sinus. Then after that, there are presence of many large granular pits which are present on both sides of the sagittal sulcus. These are called as granular foveolae, and these are the impressions of arachnoid granulations. These arachnoid granulations are basically the outbulging of the arachnoid membrane through the dura mater up to the skull bones, and these are responsible for absorbing the extra cerebrospinal fluid so that the intracranial pressure can be maintained. So these are the granular foveolae. These are the impressions of arachnoid granulations. Then afterwards, there are presence of these impressions of meningeal vessels. So anterior and posterior divisions of middle meningeal vessels, middle meningeal artery and vein. There are presence of impressions of both these, which are present in the parietal bone, just behind the coronal suture, and also running behind from anterior to posterior portion part of the skull vault. That is also the middle meningeal posterior branches of middle meningeal vessels. Then there is presence of this suture which is present between the two parietal bones and the occipital bone, which is called as the lambdoid suture. And there is in front of 2.5 to 3.75 centimeters in front of the lambdoid suture, there are presence of two um, foramen on each side of the sagittal suture. Sagittal suture is the suture which is present in the midline between the two parietal bones. So on both sides of this sagittal suture, there is presence of one foramen on each side, which is called as parietal foramen. So this is all about the structures which are present in the internal surface of cranial vault. Now in next video, we'll be learning about the internal surface of cranial base and what all structures and foramen which are present in that surface. Thank you so much.